guys, today we're going to talk about sciatic nerve pain, what it is, and a few things that you can do to relieve that tension instantly. So, a lot of research suggests that it could be a bulging disc or stenosis, some sort of narrowing of the spine. But the truth is, the sciatic nerve doesn't even start to form until the base of the spine, right below the sacrum. It's when these five nerve roots kind of weave together and they start to run down the back of the leg. And when they get to the knee, they kind of branch off and go down the bottom portion of the leg towards the foot. But what's really causing this pain that we're feeling is this piriformis muscle. And all that happens is this muscle gets super tight and it just presses on that nerve. And what we don't want to do with nerve are two things. We never want to impinge nerve, right? We never want to press on nerve. And we don't want to stretch nerve either. We want nerve to just be gliding between these different fascial planes or these muscles in the body. And so we're going to get into stretching the piriformis today. But remember, we don't want to stretch nerve. So if anything feels super nervy, if you feel that sharp pain shooting down your leg, anything worsen, then we want to come out of the stretch, breathe into it, and then we could try to come back in a little at a time. But let's go ahead and start by lying down on our back. So when you arrive on your back, we're going to bring both feet right to the ground. And the side that the sciatica is really acting up on, we're going to take that knee, and we're just going to hug it into the chest. And we're going to take the ankle of that leg and see if we can place it on the thigh. Now, if you have to use your hands to place it on the thigh, then I want you to extend the leg more so that you don't have to, because we don't want to torque the knee as we're doing this. But as long as you can get the foot up there without forcing it up there, we're just going to take this knee, and what we're going to do is we're going to bring this knee towards the opposite shoulder. So just hugging this knee towards the opposite shoulder, this is going to target that piriformis muscle. So I'm just going to take my right hand, slide it down towards the foot so that I'm actually grabbing the foot and the knee, just moving this over. I'm going to hold here for about 4 to 5 seconds, and then I'm just going to come off, remembering to breathe, and then I'm just going to come back in again. We'll do this 3 to 5 times. Just making sure that we're not holding too long, not creating too much tension there, but letting the nervous system know it's okay by coming out and then going back in. See if you can go a little bit deeper each time. And then once we get through our rounds there, keeping the ankle on the thigh, we're going to take that knee and energetically move it away. So again, I'm not forcing the knee, but we're just moving it away on its own. And if this feels okay, then we're going to lift the right foot off of the ground. And again, as long as this feels all right, I'm going to reach under and grab underneath the right thigh and really just assist that right knee towards the right shoulder, moving the left knee away. We'll hold here for just a little bit longer, maybe about 10 seconds. And then you can come out and you can go back in a couple of times if you choose. Or we just move on to our third stretch, keeping the legs crossed like this. We're just going to allow the legs to fall to the right side or to that opposite side here. The foot may come all the way to the earth. You can extend this left arm, and to get a full twist of the body, we can even gaze towards that hand if that's okay. If this bothers your neck, then just look straight up. Stay in a comfortable position for you. Or we're just trying to open up this hip a little bit. This is not necessarily targeting the piriformis directly, but it's targeting some muscles that could be tight, that's pulling towards that piriformis. And then we're just coming back through center. And we slide both legs out and we just shake them out. And go ahead and move on to the other side just to even things out. And if you have any questions, go ahead and leave those in the comment and I'll get those answered right away. And if this video was helpful, make sure you click the subscribe button and we'll see you next time.